You are listening to Speak Up and Stay Alive Radio. I am Pat Rullo, your healthcare and hospital survival guide. During my live healthcare and hospital safety presentations, many folks approach me about their stories acting as a patient advocate for someone in their family. And many want to do more to help others, but don't know how. How does one go about becoming a real patient advocate? Or is there such a thing? Are people actually trained to do this kind of work? And on the flip side, many folks have never given thought to why one would even need a patient advocate in the first place. Even though we've discussed these things on the show before, it's always good to hear from another expert resource. And that is why I'm happy to have today's guest with us. She is Anne Llewellyn, a nurse and editor-in-chief with Dorland Health, national healthcare publication. Dorland Health established the Professional Patient Advocate Institute to meet the needs of professionals moving into the area of patient advocacy. The Institute is a member organization that provides training, resources, events, and networking opportunities for professionals involved in patient advocacy. Anne has been a nurse for over 30 years. She is board certified case manager and certified registered rehabilitation nurse, and author of the Nurse Review and Resource Manual, Nursing Case Management, published by the American Nurses Credentialing Center, which is now in its 3rd edition. I cannot think of a better resource, so welcome to the show, Anne.
Thanks, Pat.
I'm glad you're here. Anne, first, if you would, I'm always interested to find out how folks arrive at their current position. Tell us how you came to patient advocacy.
I think from my training as a nurse and wanting to be able to help people and realizing how complex the healthcare system is, that's a natural focus to be able to understand the system and then help people navigate through it. Because traditionally when the average person comes into the healthcare system, it's foreign to them. So having a nurse or someone to help them understand how the system works, break down barriers to the system, that's kind of like my natural transition from a nurse to a case manager to a patient advocate.
We always talk about patient advocates. Who are patient advocates, and are there different categories?
Patient advocacy is an emerging practice. There's people who are patient advocates who were actual patients, or had family members who were actual patients who might have went through a tough situation and they want to help other people so they don't go through the same thing. And they really try to get across the importance of the person having a voice in their health care and not to be afraid to speak up and ask questions. Then there are professional advocates who are healthcare professionals or have some area of expertise in the healthcare industry. That can be a nurse, a physician, a social worker, someone who has a background in behavioral health. And those people are advocates. Many of them are independent advocates, have moved in independent practice, and are working directly with the consumer. Many people correlate it to a financial planner. Many of us don't really understand investments, the financial industry, and what would be the best investment for us to put our money. So we hire a financial planner to help us find those resources and to make suggestions that we might be able to follow. We have the ultimate decision in that, and we're responsible for that. But the expert, who's the financial planner, can gather all the information and ideas that the person can consider. So a patient advocate is similar to that, only referring it to the healthcare system.
Right. So as a patient, we can go out into the marketplace and find someone who is a patient advocate to help us navigate the system. Then there's also patient advocates within a hospital that work for the hospital.
Right. Those advocates are there also, again, to help the person have a voice. If you're in the hospital and you have a challenging situation, there's usually a patient advocate, a patient representative. Some hospitals, especially the cancer centers, have navigators that help people from the day they walk, the minute they walk into the facility, to understand all the things that are going to happen. So, yeah, hospitals are also employing advocates to improve the patient experience and to be there as a voice, help them have a voice. If something happens, if there's a medical error, or if there's a challenging situation with the staff, that patient advocate or hospital advocate will be there and help that patient have a voice and be there to ensure that the rights of that patient are followed.
Why would a patient even need a patient advocate? Let's just talk about that a bit.
Well, today healthcare is complex, a lot of different choices, and one of the big reasons is people are having to pay more and more for their health care. They're becoming more savvy consumers. In the past, traditionally, physicians would write orders and the physician's office or the hospital would clear everything through the insurance company, and the person would be told where to go to get the test or procedure, and they would go there. And today, it's a little more complicated than that because sometimes certain things aren't covered. There are certain providers that people need to go to. If they don't go to them, then they may have to pay more, which they're not even aware of. So when somebody comes into the healthcare system, maybe that was well, and all of a sudden they're thrust into the system, they're not used to the way the system works. And having an advocate with you can help you make sure the care is appropriate, that it's safe, and that you have choices as to where you can get treatment and who you can get treatment from. So the advocate really, again, researches the information and helps provides choices for the consumer and then also make sure that those choices are the right ones, and then if there are any issues, the advocate can bring them to the forefront and help the team work them out. It really is a collaborative effort between the patient, the advocate, and the healthcare team. But a lot of people start to think that they want somebody to be there for them that might have some distance from the payer or the providers, and that's where the advocate comes in.
What should we be looking for in a patient advocate?
Currently, there is no formal license or credential that would indicate a patient advocate. So you would have to interview someone, look at their background, make sure that they have healthcare experience. If that's what you're using an advocate for, it's for healthcare, for clinical diagnosis, to learn about treatment options. So you would want to make sure someone had that kind of experience. Maybe ask for references from another. They have worked with other people as an advocate, and background to understand the diagnosis or the situation that the person's in would be important to find out. If they've taken any courses in advocacy, that's something else that you might want to ask. So there are people who take courses in patient advocacy, so they're up to date on the trends and issues, and then have expertise in the area that is important to you.
Right. So, Anne, tell us a little more about the Professional Patient Advocate Institute. What do you do there, and what do our listeners need to know about that?
The Professional Patient Advocate Institute is a member organization that brings together people who are in patient advocacy. I think our organization is unique in that it does bring together the private advocate. It also brings together the hospital advocate. And then there are some, right now it's pretty much in its infancy, but even the insurance company is starting to put in place patient advocates because, again, making sure the patient has a good experience and then utilizes the system appropriately is important to them as the insurer. So that's another area. Some employers are starting to bring on advocates to help their employees when they have complex conditions, or they might be a caregiver and someone is sick. So the Institute is one way to bring that together. We also do training for people who want to learn about patient advocacy from a professional standpoint. It's a very aggressive program, so it is for people who have healthcare experience. The website is patientadvocatetraining.com. That has all the information, and if anybody wanted to reach out to learn more about patient advocacy, I'd be glad to talk to them and send them resources that meet their needs. I mean, our organization is there, but there are other organizations that might meet people's needs too, and I'm always like to offer that because it has to be right for the person.
Well, good. So I encourage our listeners, if you're interested in becoming a patient advocate, either a private patient advocate or a professional patient advocate, you have two different training programs, one for each. And do you have any final words of advice for us today?
It's important that people realize that they do need to bring somebody with them into the healthcare system, and they need to be alert and ask questions, and don't ever be afraid to ask questions. Sometimes the healthcare system is not friendly, but it's your life and it's your care, and you have a right to be involved in that. So if there are the best patient advocates are the ones, family members are their own patient advocates, but also there are other people, professionals out there who are trained to do this. So if you find yourself in a situation where you're really not sure, it might be worthwhile to look for a patient advocate.
Well, thank you. And I'm going to encourage our listeners, because you do have those resources on your website. You have a specific link to locate patient advocates. And so I encourage everyone to go to www.patientadvocatetraining.com. Thank you, Anne, for being with us today. And thank you for all you do to help make healthcare a safer experience.
Thanks, Pat, and thanks for covering this. It's important that we get the word out.
Thank you.